Hey everybody, let's talk about Chapter 9, Maternal and Fetal Nutrition, about nutrition education for the patient. In this recorded PowerPoint, apparently my face is covering part of this chart, but it'll be in your printed PowerPoint if you print that. So you can just take a look at that, but it's just kind of the general proportionate plate that's recommended for eating. We want to educate our patients to make sure they're reading food labels. We want to make sure that they are aware of how much sugar they're taking in and how much fat, because they need to lean more toward the protein side of things, but at least trying to keep their macros balanced, right? And we want to lean heavier on vegetables and grains, and then balance it with proteins and fruits. But not a lot of just fluff, right? We want to eat foods that are nutrient dense as well. There is a specific pattern of weight gain that we hope to see. All moms should gain some weight, even overweight and obese moms. That's because we don't want them dieting while they're pregnant. We want them to maintain good nutrition. And also there's a lot of weight that's gained during pregnancy that isn't actually packing on the pounds, right? It's the baby is going to weigh, by the time the baby delivers, maybe 6 to 8 pounds, somewhere in there on average, we'll say. But the placenta carries weight as well, and also the mom's blood volume has expanded, so she's carrying more fluid in her blood volume. She's also got amniotic fluid, and so on and so forth. So there's lots that accounts for the weight that is gained. Now, underweight moms with a BMI less than 18.5, and you'll want to, keep track of, be aware of the categories of BMI and the recommended weight gain. So BMI less than 18.5, we want them to gain at least 28 pounds, almost 30 pounds during their pregnancy. And then a normal BMI, we expect moms to gain 25 to 35 pounds. If you're overweight, minimum 15-pound weight gain up to 25. And if obese, greater than 30 BMI, minimum 11-pound weight gain up to 20 pounds. And then, of course, a twin pregnancy, we would expect those moms to gain a little bit more, 35 to 45 pounds. The pattern of weight gain is also important. She should gain about 1/2 of a kilogram to 2 kilograms, which in America, of course, we know pounds better, so 1.1 to 4.4 pounds in the first trimester. So she shouldn't be gaining the bulk of her weight during the first trimester. Most of the weight is going to be gained in the second and third trimesters at the rate of about 1 pound per week. The mom's nutrition level correlates directly with the baby's health. Okay, it's very important as the baby is growing and developing that mom has good nutrition. Good nutrition is an important preventative measure for a variety of problems, because the lack of various nutrients can actually contribute to preeclampsia and other conditions in pregnancy. We want moms to take in an extra 350 to 450 calories per day in the second and third trimester. That will, over whatever their standard non-pregnancy diet was, if they take that many more, that will maintain the pregnancy in a healthy way, not too much, not too little. And then when breastfeeding after delivery, she actually consumes even more calories to produce breast milk. So 500 calories per day. We talked about BMI a little bit on the last slide or two, but BMI is calculated by taking the weight in kilograms and dividing it by the height in meters squared. So There's a BMI, and again, a normal BMI, those moms should gain 25 to 35 pounds. We mentioned this, and you can see table 19.1 to give you a little more detail, and as always, please reference your book to find out lots more. Okay, some specific nutrients to consider. DHA is important for brain development, can be found in fish, egg yolks, and poultry. Folic acid we've talked about already in this course even, but it's extremely important to prevent neural tube defects like spina bifida and anencephaly. It's most important to take before conception because the neural tube is already closed by the time most people know that they're even pregnant. So anybody that could get pregnant, or especially if you're planning to get pregnant, you would want to be making sure you're getting enough folic acid. Folic acid can be found naturally in beans, potatoes, and leafy greens, and of course many pregnancy supplements contain folic acid as well, and prenatal supplements. Iron, if a mother is anemic, oftentimes it's iron deficiency anemia, and they might put her on iron supplementation. It can definitely cause some constipation, so we're going to want to be aware of that. That's an issue oftentimes anyway in pregnancy, so we're just going to be touching base with her about that. But if she's going to want to make sure she doesn't take the iron with coffee, tea, or high calcium foods because those can inhibit absorption. But taking it with orange juice or something with vitamin C would enhance the absorption of the iron. It can cause dark stools as well. Vitamin D is important for placental implantation and fetal growth. We want to make sure we're getting enough vitamin D. And then one important consideration for moms that are vegetarian or vegan, they often have a hard time getting enough B12 in their diet. B12 contains folic acid, so they sometimes need a B12 supplementation to reduce the risk of spina bifida. All right, again, constipation is a very common sort of side effect or complaint in pregnancy. Constipation and bloating. So we would recommend to these moms a natural way to try to manage that, to increase their fluid intake, make sure they're eating lots of fruits and veggies, and to walk more. All that can improve the peristalsis of the intestines and encourage regular bowel movements. Pyrosis is the medical term for heartburn. Also very common in pregnancy. For this, we would recommend small, frequent meals through the day, avoid spicy or acidic foods, and drink milk or warm tea between meals. Okay. We all know probably that nausea and vomiting is very common in pregnancy as well, especially in the first trimester. Sometimes a doctor can prescribe antiemetics, but some homeopathic kind of methods to manage might be to take B6, vitamin B6, ginger, acupressure, peppermint also can be helpful for that, and we would advise her to avoid an empty stomach. Eat dry carbs in the morning. So many of us again have heard about keeping crackers by the bed. Eat a few crackers before you get up, and not mixing liquids with it. So we would recommend that she alternates food and fluids every hour. So keep sipping, keep eating, but every hour don't let your stomach completely empty, right? So we're kind of grazing through the day, but don't have the food and drink at the same time because that can kind of make the nausea worse. All right, and pica. It's a craving for consuming non-food substances or something with excessively low nutritional value. It's most common in African American and Hispanic cultures. but it is also and can be a sign of iron deficiency anemia. So it's something that we are kind of on the lookout for. These moms will have cravings for clay, dirt, starch, like potato starch, ice, and freezer frost. And then adolescent pregnancies, they are increased risk for low birth weight and anemia because of basically inadequate nutrition. So an adolescent pregnancy is going to be an automatic consult to the dietitian. We want to have an expert talk to them and really encourage them to not be thinking about their image when they're pregnant. They need to make sure they're gaining weight, and that gaining weight is a good thing when you're pregnant. All right, and then other diabetes, as you can imagine, is a huge dietary consideration anyway, even when you're not pregnant, and then especially if you are pregnant. They're going to need a dietitian consult and all sorts of monitoring to make sure their blood sugars are staying within a healthy range. This chart is in your book, and any of these would indicate a nutritional risk in pregnancy. So just kind of review over this list to kind of familiarize yourself with what are some reasons that a mother might be high risk nutritionally. Again, we talked about adolescence. Also frequent pregnancies, because her body is already depleted of many of the nutrients needed to maintain a pregnancy. If she'd had a poor outcome in a previous pregnancy, and of course poverty or food insecurity. Drug and alcohol, tobacco abuse, and a multi-fetal pregnancy, so twins or triplets, and a low H&H, and other chronic illnesses. All things that we'd want to consider very carefully and put in a consult to the dietitian. Okay, nutrition after birth, aka postpartum. Moms need to consume even more calories when they are breastfeeding. So earlier in the slides it said 500 calories. It says that here too, but it's kind of broken down that into 330 and then 170 for the maternal supply. So in summary, 500 calories a day increased over her normal diet if she is breastfeeding. And then the next so that's the first 6 months postpartum. The second 6 months postpartum, that can decrease to 400 calories, and you can kind of logically think about that because by that time the baby is taking some solid foods, beginning to take solid foods, so the demand for her milk is a little bit less. If a postpartum woman is bottle feeding, not breastfeeding, then she just goes back to her regular diet. She doesn't need to add any calories just for the recovery there. And of course we want to avoid alcohol, smoking, and excessive caffeine while breastfeeding. And we'll talk more about breastfeeding in one of the later chapters. Okay, and just to review, adolescents are automatically nutrition high risk. Also, no amount of alcohol is safe. That's for pregnancy and for during breastfeeding. We want moms to pump and dump, okay? But especially in pregnancy, we don't know what the threshold is for fetal alcohol syndrome. So we're gonna really discourage alcohol. We are going to encourage foods high in iron, DHA, which is omega-3 fatty acids, very important for neurodevelopment. We would be watching, listening for pica and for signs that a mom might be experiencing pica, and we would think of iron deficiency associated with that. Average weight gain, again, is 25 to 35 pounds. Moms should increase their calories by 300 per day during pregnancy. The first trimester, of course, is critical, and remember, it's really the first 8 weeks that are the most critical during embryonic development. And eating a healthy diet before conception will give your baby the best chance for optimal development. Folic acid is extremely important to prevent neural tube defects. We didn't actually mention this, and it's partly blocked by my video again, but we want to make sure that moms are avoiding raw seafood, lunch meat that isn't heated, honey, all those kinds of raw foods, and also making sure that any fruits and veggies are washed, because they can carry bacteria that can be harmful. During pregnancy, your immune system is suppressed, so that to prevent your body from considering the baby to be a threat, right, a foreign object. So that's why eating some of these raw foods and unwashed things can be a danger to you during pregnancy when they're not necessarily otherwise. That is it for this chapter. Happy studying.